The following Ask the Expert segment is sponsored by Kennebec Behavioral Health.
About 1 in 5 kids in the U.S. struggle with mental, emotional, or behavioral challenges. The good news is therapies can help, but often for parents, it's difficult to know what your role should be in that therapy. Jacquelynne Charity with Kennebec Behavioral Health is here to help us sort of navigate this. Jackie, thank you for being here. First of all, let's talk about some of the common and effective therapies for children who struggle.
There are a variety. We use MATCH, which is a modular approach to cognitive behavior therapy, and it's effective for children who experience anxiety, trauma, depression, and behavioral challenges. We also use TFCBT, trauma-focused cognitive behavior therapy, dialectical behavior therapy. So there are a lot of evidence-based practices to help families with these challenges.
And for parents, it can be difficult to sort of know what your role is in here. What is that sort of fine line when it comes to parental involvement?
We really do encourage a high degree of parental involvement, and that will vary depending on the age of the child and the particular needs of the child. Younger children tend to need a higher degree of involvement, so that may include more frequent check-ins with the parent or even having the parent attending the entire session. With the parent also learning the skills along with the child so they can reinforce those skills at home and help remind the child when it's time to practice. Older children, preteens, teens, may need a level of lower involvement from the parent, but still a level of involvement. And conversation between the parent, child, and the clinician can help determine what's the best level of involvement. We really encourage that conversation between the provider and the family to determine what's best for that child.
Overall, what kind of results do you see based on parental involvement?
Children learn emotion regulation, they learn skills in the context of their close relationships, and that's typically going to be with a parent or caregiver. So we know that studies actually show us that when we have that parental involvement, children will do better with emotional health, behavioral health issues. So,
what about for parents who might be struggling themselves?
An event that impacts a child often impacts the entire family. Other family members may struggle with guilt or shame. So therapy can help the family process that event, learn how to facilitate conversation. Avoidance is often an issue that promotes the problem.
How do people find more information?
You can call us at our main number or reach us on our website.
Jackie, thanks so much for this information. Really appreciate it.
Thank you.
And of course, you'll find more information on WGME.com.